Beyond the Paper Gown inspires, informs, and empowers women with the latest information about our health and healthcare choices. Join in for provocative conversations with scientists, clinicians, policymakers, and innovators. Beyond the Paper Gown is hosted by Dr. Mitzi Kralovetz, internal medicine specialist and women's health advocate. The following information is for entertainment, educational, and informational purposes only. This information is not intended as a substitute for professional therapy or medical advice, diagnosis, or treatment.
Hi, I'm Dr. Mitzi Kralovetz, and welcome to Beyond the Paper Gown. Our topic today is the vaginal biome. And before we get started, just a bit of a heads up. This is a very full episode, and while there may be some words you are not familiar with, that shouldn't deter you from listening, because you are hearing these words straight from the scientist who is doing real-time research in an area that has been ignored for way too long. And I'll help decode along the way. Plus, it's good to learn new words. At the very least, you can have something to talk about at cocktail parties. You remember those. So today we are going to talk about the vaginal biome, which in many ways is similar to the gut biome that you might already be familiar with. As you know, bacteria in our gut can affect our health and impact how we feel. In a similar way, the balance of bacteria in our vagina can also affect us at any age, leading to issues such as vaginal, urinary tract, and sexually transmitted infections, and even complications with pregnancy. One specific infection that is created by an imbalance of the vaginal biome is bacterial vaginosis. It's also referred to as BV. This is an infection of the vagina that causes symptoms such as odor, itching, and discharge. Many women seek treatment only to find it recur time and again. BV has been associated with preterm labor and low birth weight babies, making it an important area of study. We'll talk about BV in more detail later in the podcast. We'll also learn that there are many things that affect our biome. We'll talk about what we can do to make that biome as healthy as possible. We'll also talk about the latest research on treatment options that may be needed if someone is having recurrent infections, for example. And we'll find out what the vagina and a self-cleaning oven have in common. You'll want to stay tuned for that. So to start off, here are some of the words you may not be familiar with. The vaginal epithelium is a lining of the vagina. Dysbiotic means unbalanced as related to the vaginal biome. And antimicrobials are products that fight against microorganisms. Antibiotics are antimicrobials. And don't worry, there won't be a test on any of these, but hopefully it'll help you enjoy the program a little bit more easily. So let's get started. It's my pleasure today to have Dr. Melissa Herbst-Kralovetz, an associate professor at the University of Arizona College of Medicine, Phoenix, and director of the Women's Health Research Program and the Microbiome Initiative. I just have to give a little anecdote that I first met Melissa when she was a postdoc at Arizona State University. And she was the one who introduced me to this entire concept. I didn't even know we had a vaginal biome. It certainly wasn't something that I learned in medical school. And so was really thrilled to learn about it. And, years later, to know that she's been doing a lot of research in this area and has chosen to come and share that with us. So welcome, Melissa. So good to have you.
Thank you so much for having me, and also kind of sharing with your listeners and viewers more about this topic.
Absolutely. So, okay, we'll start out with what is the vaginal biome and why should we care?
Right. It's a great question. And like you said, many people don't even know that we have a kind of community of bacteria that are working to keep us healthy in the female reproductive tract. So most people know that you have a gut microbiome, and that gut microbiome contributes to health as well as disease. And that's where we've really generated the most research, both on men and women. However, the vaginal cavity also has a unique ecosystem that's very different from the gut and other sites, other mucosal sites. And so what we know about the vaginal microbiome is that there are similar bugs to what you find in the gut in terms of health. So we know that lactobacilli dominance within these microbial communities contribute to health and homeostasis. Once those lactobacilli are depleted and you have an overgrowth of other bacteria, then that sets you up for a whole host of bad things, adverse health outcomes. And so when we first met, that was really, we were just starting to do research in that area. At first I wanted nothing to do with it because it was very complex. It is an enigma. We still don't know as much as we would like to know about this condition. And
why is that? We've had vaginas for, as long as we've had women. There's a lot going on in the gut biome. How come we don't know more about the vaginal biome?
Yeah. So, in the 1800s, we knew that lactobacilli actually contribute to health. And they were described by a German doctor back in the 1800s. And so we have known a little bit about the bacteria, that there are bacteria in the vaginal cavity and that they do contribute to a healthy state. And when those bacteria get disrupted, then you can be at risk for other conditions. However, the microbiome and all of the sequencing technology got to the point where it was cheap enough, essentially, to perform these sequencing studies so that we could sequence individual people and start to really investigate. And that's really been this last decade where we've seen more research on the vaginal microbiome, where we're profiling through sequencing technology all of these organisms and really finding out just how complex women are. You and I know women are complex,
sure.
But the vaginal communities are quite complex too, and have been likened to a signature within women that can change and fluctuate depending on a variety of different factors.
Tell us about those factors. How do those factors impact the biome?
Yeah, so there are a lot of things that can disrupt those, the lactobacilli or just the bacteria in general in the vagina. One of the main issues is having sex. So that's every type of sex can put you at risk for bacterial vaginosis. Douching, we know.
So anything you introduce into the vagina is going to change that microbiome?
Right, exactly. But sex in particular, women that have sex with men, women that have sex with women, that has been shown to contribute to risk of developing bacterial vaginosis. If there is a woman that has BV and she's having sex with another woman, that will be transmitted to that partner. The same thing with men and women. It's interesting, there's been some studies where they looked at couples and looked at the penile microbiome and BV, basically in women, and found that men that were partnered with women that had BV had more of these BV-associated organisms within their penile microbiome versus those men that had partners that did not have BV. Had less of these BV-associated organisms. So there is a really nice link, and a lot of people have been working very hard around the globe to study this, and there's been some really elegant studies out to show that this, really is associated with these sexual activities, and that it relates back to the partner's composition of their microbiome as well. But going back to your question on sexual transmission, we can't just say it's one agent, it's one microbe, and then transfer that and show that it causes disease. And that's why we really can't demonstrate that it's sexually transmitted.
But your hunch is that it is. And that was when we first met, that was also the big surprise that potentially BV could be a sexually transmitted disease, because that's not what we were taught in medical school, right? It was just like, we don't know why women get BV, but we also did treat it, and still do, with antibiotics. Right. So doesn't that introduce a whole host of complications?
BV is recurrent. It's highly recurrent. So these antimicrobials that we have, and you probably prescribed, don't work very well. And these women have these recurrent infections and they just can't get rid of it. So we need new, novel antimicrobials that would be effective. But going back to what you were saying too, not knowing what causes it, really, we're still kind of there where we need to better understand who are the major players, what are they doing to contribute to disease, and can we develop novel antimicrobials to target those specific bacteria, the real bad guys, if you will.
Does that also suggest that we might also need to treat the partner like we do with chlamydia, for example?
So that's a great question. And there's been a lot of studies trying that, and it's not effective. But it's unfortunate because that would be really helpful if we could do something to intervene with the partner.
Tell us a little bit about what BV is and why we're so interested in it.
Basically, it's bacterial vaginosis, and it's really when you have that depletion of those lactobacilli and an overgrowth of these anaerobic organisms that we kind of label as BV-associated bacteria.
What are some of the implications if someone has BV? There are symptoms of a discharge, sometimes it smells, that kind of thing, but it's important to treat, and I'll let you answer that question in terms of why should we treat it?
Right. So it does set you up for a higher risk of every sexually transmitted infection. So gonorrhea, chlamydia, HIV, HSV, trichomonas. It really does set you up for every viral, bacterial, and parasitic sexually transmitted infection. So that's huge in itself. It's very well documented. So that's a huge risk. And I didn't mention HPV too. So it sets you up for all of these STI infections, but it can also impact your health if you're pregnant. It could impact you, and you could deliver early through preterm labor. You can also have low birth weight infants. Have been associated with bacterial vaginosis, and then other gynecologic complications, post-surgical infections, for example. And then also in terms of your reproductive health, there's data to suggest that it can impact fertility.
So it's important, obviously, not to ignore any symptoms and to actually get it addressed. And you also told me a little bit about some of your studies on women of color and how that impacts their symptoms and their treatment.
So African American and Hispanic women have higher rates of bacterial vaginosis. And so it's really important that we are conducting studies within those populations of women to address that health disparity. We don't really know about other populations. So here in Arizona, we really are intentional with our studies to include Latinas as well as Native women throughout Arizona, so that we have a nice, diverse representation of these understudied and underserved women to better understand their vaginal microbiome and factors that might be influencing.
We know that we have in America terrible outcomes when it comes to maternal child mortality, especially in the first year of life, and that those underrepresented groups are more at risk. So do you see that there possibly could be that connection between the biome, BV, and those complications?
Absolutely, yes. I think it's really important that we continue to be really intentional in our studies. So things that we've done here at College of Medicine Phoenix are to recruit bilingual clinical research coordinators so that we can enroll our Spanish-speaking only participants in our studies as well. We're also working on a Native American cancer prevention study with NAU and a clinic up in Flagstaff, Arizona.
So is there anything that we can do as women to prevent BV?
So the prevention is really not douching, is one of those things, but also not having multiple sexual partners, that definitely increases your risk. If you don't have sex, it's going to really reduce your risk, but also using a condom. So those are things that you can do, but, things that can impact dysbiosis, like smoking, other behavioral things, anything that you're putting into your vagina, like these sprays that smell like fruit or flowers, anything that you're doing that is going to basically disrupt those healthy lactobacilli is not a good thing. And we know vaginal lubricants, that's another area that we've studied recently in collaboration with University of Maryland, looking at lubricants, how they impact not only the vaginal epithelium, but how they impact these lactobacilli. And so we've found that certain compounds within those lubricants can actually impact the growth of those lactobacilli. So it's really important to think about kind of what you're putting in or on your vagina that could be impacting these delicate communities of lactobacilli.
With respect to lubricants, does it matter what kind of lubricant it is, whether it's silicone-based versus water-based, for example?
Yeah, so our studies have really looked at the osmolality of those compounds, and the WHO actually came out with guidelines. I'm happy to provide that to your listeners as a link so that they can go through and look at that. But they have some nice guidelines on in terms of the osmolality as well as excipients, or those parts of the lubricant that could impact those lactobacilli or the vaginal epithelium.
When you say impact, the assumption is that it's impacting it in a negative way.
You don't want to put something in your vagina that's not kind of fostering those lactobacilli.
It's kind of like looking at folks with a keener eye these days on makeup, right? We're looking at all the specific ingredients to determine which ones we choose in a lot of ways. So it sounds like that.
So why is that? That's a great point, because when you go into Sephora or Ulta now, they have their clean area, the clean makeup that have, Right. Why don't we see that in Target when we're looking at lubricants?
All right, Target, if you're listening, and CVS and Walgreens. Absolutely. I think that there's a movement there, an important one, actually. So I touched upon the issues of dryness, and obviously that changes happen as you age in the vagina. So take us a little bit through that, and then what happens to the biome during those phases.
Absolutely. So we know that the vaginal microbiome changes throughout a female's lifespan. So when you, basically women that are premenarcheal,
which means?
Before they have initiated menses, they basically have a non-lactobacilli dominant flora. And the epithelium is not very thick. You don't have a lot of what we call glycogen. Glycogen is a food source for lactobacilli. And so as we age and start to have more estrogen and move into that premenopausal reproductive age, that's when the estrogen levels go up. You have a thicker vaginal epithelium. You have more glycogen within that epithelium, so more food for those lactobacilli. And so you have that lactobacilli dominant state in those healthy premenopausal women. Then once you enter into perimenopause and menopause, those estrogen levels can decrease, and then that epithelium changes.
Let's recap. As we discussed at the beginning of the podcast, the epithelium is the lining of the vagina. That lining thickens with the increase in estrogen as a woman enters puberty and reproductive age. The lining contains glycogen, which is a food source for the good bacteria. However, during menopause, estrogen levels decline, the lining thins, glycogen is reduced. The levels of the lactobacillus, or good bacteria, plummet.
And then there, it's like there's no lactobacillus, there's no bacteria, really. So then you can replace back through hormone replacement therapy those hormones, and then you have again reproliferation, thickening of the epithelium, more glycogen, and you can restore that lactobacilli dominance. And that's been shown both with local as well as systemic HRT.
Meaning vaginal estrogen versus oral pills. But if somebody does not want to go on hormone therapy, any other options for them in terms of their biome?
At this point, I don't know of anything that can restore that. And I think that's unfortunate, especially for women that suffer from sexual health issues related to that depletion of lactobacilli. Women that have went through breast cancer therapy, for example.
Exactly.
And they're kind of suffering in silence. So that's been an area that I've wanted to do studies in for so many years, to try to figure out how we could do something for those women, or, the safety of giving low levels of estrogen locally within those patient populations to restore not only the epithelium, but the lactobacilli.
Another opportunity for research.
Yes.
In a very needed area. You actually told me, again, something of interest, that there is an effect on the biome by stress and exercise. Can you tell us a little bit more about that?
So this is a new area for sure. And I think maybe I mentioned exercise in terms of promoting a healthy lifestyle. We know that when you live a healthy lifestyle and you reduce your levels of stress through exercise, that you're going to have, overall health. We do know that stress has been linked to bacterial vaginosis and risk of bacterial vaginosis. But we need more studies in that area as well. We're really interested in this topic. As you know, especially with the pandemic, women have been disproportionately impacted by the pandemic, having exorbitant amounts of stress.
Right.
And so definitely not good for our overall health, but also our vaginal microbiome.
I think that's actually fascinating on a lot of levels in terms of the mind-body connection, just another example of that. And then the other interesting item that you told me about was that oral contraceptives can actually affect the vaginal biome.
Absolutely. Yes. So more of the progestin-based contraceptives have been shown to decrease risk of bacterial vaginosis and promote lactobacilli dominance. It makes sense because we know hormones impact the vaginal microbiome.
So that's actually could be a factor when somebody's trying to decide what kind of contraception to use then. We look at everything from acne to mood, and now perhaps even looking at if you have a lot of recurrent infections, this might be another factor to make that decision. I think you also said that periods can affect the biome. And does tampons or pads make a difference?
Yeah, there's been very limited studies on using tampons. I think that most of that's been centered on toxic shock syndrome and those organisms. But going back to menses, we know that there's this normal fluctuation of the vaginal microbiota during menses. You have this pH change and you do have these fluctuations. It does put you at risk for BV. So women just after menses, that's a really kind of time where they're more likely to develop BV, is because you've had that transition and that fluctuation. So a lot of women report BV after menses.
Oh, that's interesting. And you also touched upon earlier when we were speaking about the effect on HPV. And we know that HPV can be a factor in cervical cancer. Tell us about that relationship.
Yeah, absolutely. This is a really intriguing area of research in our lab. So I love talking about it. So we've known for many years that HPV is the causative agent, going back to that causative agent discussion for cervical cancer.
Sure.
HPV is very common, and most women that get infected with the HPV actually clear it no problem. it's the women that have the HPV persistence that progresses to cervical cancer. So we started a study several years ago, probably 7 or so years ago, where we wanted to really investigate, does the vaginal microbiome play a role in persistence and progression to cervical cancer? Basically, the take home is that HPV persistence and progression to cervical cancer is associated with the non-lactobacilli dominant community, or BV, whereas clearance is associated with lactobacilli dominance. And so that's really interesting. We're following up on that. We want to know what are the specific microbial drivers that might be promoting carcinogenesis or cancer in the environment, or promoting that HPV persistence and progression. So that's a really interesting area of study.
And if I'm correct in remembering, you said that smoking, for example, could change the biome to make it a more persistent HPV environment?
It has been associated as a risk factor for HPV and cancer, but we do know that smoking also changes your vaginal microbiome, and you have a higher risk of BV and dysbiosis. So again, depleting those lactobacilli, and you have more of these non-lactobacilli communities in women that smoke.
Another reason to quit if you've been smoking, certainly. What about, just as we've heard about for GI biomes, probiotics, prebiotics, any information on that in terms of potentially being an opportunity? I know a lot of folks go to yogurt for the acidophilus, especially if they have a yeast infection, for example.
Absolutely. So in terms of the gut and probiotics, most of the probiotics are gut-specific lactobacilli. And so there are different lactobacilli, as I mentioned at the beginning, in your gut versus in your vagina. So we have very specific, vaginal-specific lactobacilli. And so by giving the gut-specific lactobacilli, we really haven't seen, and giving that orally, or taking that orally, we really haven't seen dramatic changes in treating BV, for example. Mm-hmm. But I always say, you could be influencing a good gut microbiome by taking that, and it could influence your vaginal microbiome. We have no data to support that. We need more studies to look into that. But the better approach would really be to take a vaginal specific lactobacilli and then deliver that locally. And so there have been ongoing clinical trials looking at how you could do that with rings, for example, with the lactobacilli. So there's a product called Lactin B that's in clinical trials right now. They've shown some success in treating BV. And then in terms of other ways to modulate the vaginal microbiome, they're also investigating vaginal microbiome transplant. And so that's a really exciting, interesting area. And there's multiple clinical trials ongoing right now to investigate that. Some of the early findings have suggested that if you treat with an antibiotic first and then come back with a vaginal microbiota transplant, that you can see some clinical benefit in terms of restoring the vaginal microbiota and keeping it in a non-BV state.
And when you talk about a transplant, can you talk a little bit more about the details of that? How does that work, and how long would you have to do that for?
So yeah, that's kind of the downfall. I think really with any probiotic, bacterial therapeutic transplant, you might have to continue to give that. But you get a donor specimen, and then you're using that donor specimen that you've identified to be lactobacilli dominant, for example, and transferring that to the participant. So you can see how just these women are so affected by recurrent BV and how they really want to try anything. And, sure. That's the thing about this whole field too. Women are going out and trying to find the right answers for what they need to cure their problem.
two things. Number one, I want to just caution, do not try this at home. The kinds of transplants that you're talking about have been processed in a laboratory and are safe to use. So
absolutely screened for all kinds of other pathogens that you do not want.
Right. Absolutely. So don't get it off the internet. And speaking of the internet, we talked about some things you might have seen or heard about.
There are, certain celebrities that promote things that you don't want to do to your vagina.
Such as like steaming. Let's go ahead and say it.
Right.
Yes. Not exactly. A good thing. I will go on record to saying that as well.
Right. So I think that women are vulnerable, especially when they are faced with a recurrent condition like recurrent BV. They get desperate. They want answers. They want an effective treatment. And we need, more funding in this area, more focus. And so thank you again for having me here today. Hopefully it will, shine a spotlight on some of these issues and kind of unanswered questions that have just not been tackled yet.
Absolutely. And to that end, if someone is suffering from any of these issues and wants more credible information, number one, do they know that it's credible? I'm going to put it out there that I'm sure that not a lot of physicians have this up-to-date data, if you will, or were maybe taught in medical school about it. So how do you introduce the conversation with your healthcare provider? Any thoughts on that?
Yeah, I agree that it's not as mainstream, or people don't realize all of the other health implications that have been associated with bacterial vaginosis. In terms of diagnosis, for example, there are a lot of new molecular tests that can be employed by the providers. What I've heard from friends, other OBGYNs, for example, they have a hard time interpreting that data. Who do we treat? Who don't we treat? And then getting those guidelines out there to the providers, to the boots on the ground that are going to be delivering this care to those women. It's multifactorial.
All of this is interesting information, right? But if you're one of the more than 20 million women with recurrent vaginal infections, it's important to bring it up with your physician because of all the complications we talked about earlier. But it may not be easy. This is new information that your provider may not know about. Unfortunately, not unusual when it comes to women's health issues. But you can take steps to get the help you need.
So I would start with your provider. I think that's the best place to start, and, definitely go in and have that discussion with them if you have some of these symptoms, or you just want to have that kind of reassurance. In terms of if you have, recurrent BV and are having these issues, there are some amazing experts throughout the nation, OBGYNs as well as infectious disease specialists. It's really hard when we don't have those experts that we can refer to.
Well, maybe they can take this podcast and share it with their provider. So what did I not ask you that you think is important to let our listeners know?
Just, the awareness that you have these delicate communities of bacteria or ecosystems within the vagina that can contribute to your gynecologic, reproductive, and obstetric health, and to be aware of that, and to be aware of the things that you are putting in or on your vagina.
And I would assume that that's your takeaway and your action item, or maybe the non-action item that you want us to think about.
Yeah, there's a great analogy that I think circulates among OBGYN residencies about, the vagina being a self-cleaning oven. And I heard that years ago, and I really believe in that. And I think it's a great analogy of just leave it alone. You don't need to do much. It's going to clean itself. It's okay. And it doesn't need to smell like flowers.
Dr. Melissa Herbst-Kralovetz, thank you so much for sharing all this information. We'll put the links in our notes. And again, thank you so much for being with us.
Thank you for having me. I really appreciate it.
So there you have it. And here are the takeaways. We all have a community of bacteria in the female reproductive tract that are working to keep us healthy. It's called the vaginal biome. If the biome becomes unbalanced, then problems like bacterial vaginosis or BV can occur. BV can be transmitted sexually, and these infections are hard to cure. They can also lead to more problems, like other sexually transmitted diseases and complications with childbirth. Things that affect our biome include our hormone status, smoking, stress, and what we put into our vaginas, including lubricants, perfumes, and tampons. Research on pre- and probiotics, biome transplant, and hormone therapy may provide clues to cure bacterial vaginosis. And if you are one of the many women with recurrent vaginal infections, it's important to bring it up with your physician because of all the complications we've talked about earlier. I also invite you to listen to our mini-sode, where I talk with Peta Navarro, Chief Science Officer at Evi, a company who is not only analyzing each client's vaginal biome, but also contributing to the science that might help bring needed solutions to infections such as bacterial vaginosis. Finally, I encourage you to commit to one action you've learned about today to keep your biome healthy. What will you pick? Let us know at beyondthepapergown.com or on any of our social media. We're on Twitter, Instagram, and LinkedIn. Thanks for listening.
I do hope you'll join us if you enjoyed today's episode. Please subscribe. For more information on this episode or for additional episodes, links, and comments, find us at beyondthepapergown.com or follow us on YouTube, Instagram, Twitter, and Facebook. This episode of Beyond the Paper Gown was produced by Patrick Shambayati and Dr. Mitzi Kralovetz. Until next time, stay healthy and centered.